foot and ankle specialist is somebody who understands the detailed workings, intricacies and nuances of the way the foot and ankle presents itself, the way it functions and the way it can affect and cause pain and disability. We also need to be able to coordinate that with things that affect the rest of the body. My detailed background is full medical training and as well as doing some various surgical specialties. This has allowed me an overview of how other body systems can affect the foot and ankle and also coordinate better with other medical specialists such as vascular surgeons, rheumatologists and neurologists. I then went on to specialize further in foot and ankle problems and learnt things with other colleagues and other specialists. This then gave me a good grounding on how to offer advice, treatment, in various techniques, which can vary from surgical to non-surgical, and coordinate with other other allied healthcare specialists. That's a fairly generic question, but on the whole, most pains are related to tendon, ligament, joint pathology and problems. These problems can arise from causes of swelling, which can be either with an injury or from other reasons, other medical reasons. They can also be due to underlying joint problems such as cartilage injuries, arthritis, or autoimmune general body disorders. The commonest presentations are repetitive strain injuries, which could include tendon and joint involvement such as stress fractures, tendinopathy, and then some people have metatarsal problems due to neuromas and bunions, which also can cause problems with footwear. On the whole, majority of the pains will ease and resolve, but if they haven't, then it's worth discussing it with a foot and ankle specialist. To understand how to reduce it, we need to understand what has caused the swelling. The swelling can be from general medical conditions, and these need to be addressed, such as heart failure, kidney failure, or other venous disorders. This would entail coordinating with various specialties to help with this. Local problems to the foot and ankle that can cause ongoing swelling can be post-injury after a sprain and doesn't get better, or the arthritis and other inflammatory causes of ankle midfoot joint pains, elevation, and then we would need to look into manual treatments with specialist physiotherapists, and also then try and identify and treat the underlying causes, which would be all done at the same time to facilitate full recovery. Sprained ankles are very common. There's at least over 40 to 45,000 sprained ankles per year, and majority of them will heal very well without any ongoing problems. If you have a sprained ankle, then it would be advisable to stop the activity that you're doing and just assess whether you have swelling, and you can take weight on the leg. If you have excessive swelling which does not go away within the next 2 to 3 days, or you cannot put weight on the leg for the next 2 to 3 days, it's strongly advisable to go and see a specialist. If, however, it is getting better slowly, the best way to continue to improve it would be to use a sports brace, use elevation, swelling reduction techniques, and then go and see a physical therapist to help with facilitate the recovery. Most minor sprains will take between 2 to 3 weeks. More intermediate or partial tears or strains will take up to 3 months, and more severe injuries can take up to 18 months, particularly if there's bone bruising or other injury aspects to the sprain.